Good morning, Dr. Markle of Centennial Schultz Clinic. Today I'd like to take a moment to discuss about peripheral nerve injuries and supplementation to help recover from peripheral nerve injuries. Now, there's many different types of peripheral nerve injuries that we do treat. They range from a variety of different conditions, such as sciatica, also known as radiculopathy or radiculitis. This is usually stemming from a spine condition, some arthritis, disc herniations, irritating a nerve as it exits your spine. Next, we have general peripheral neuropathy. While our treatments typically don't treat peripheral neuropathy that's more systemic, secondary due to some more metabolic conditions such as diabetes, or any chronic medications or other things that are more systemic. But some of the supplementations we discussed today could potentially help these conditions. Also, compressive neuropathies. These fall under the category of things like carpal tunnel syndrome, thoracic outlet syndrome, cubital tunnel syndrome, tarsal tunnel syndrome, peroneal nerve injuries, and we can treat all of these with advanced regenerative orthobiologics such as platelet-rich plasma via a nerve hydrodissection. But there may be a simpler option to help recover from these injuries, such as supplementation that we'll be discussing today. And lastly, you have crush injuries that are typically happen from fractures, bad traumas, and common nerves affected by this are tibial nerve, radial nerve, and as well as intercostal nerves that run adjacent to the ribs that can get damaged in a rib fracture. So looking at traditional medicine for peripheral nerve injuries, there is a myriad of treatment options. One would be medications, physical therapy, and then another non-surgical one would be phytochemicals, or also known as oral supplementation. So vitamins, minerals, and then after that you have a host of surgical options as well as regenerative medicine options that we do here at Centennial Schultz Clinic. But let's talk about medications themselves. Well, medications basically help mask the symptoms of nerve injuries. They can help reduce the symptoms, the numbness, the tingling, the pain. But the problem with all these medications, they don't help the underlying cause. They do not help the repair of the nerve, as well as long-term wise, some of these medicines can actually be detrimental to the nerve. So while medications help short-term, long-term wise are not really helping the overall condition. And then the whole world of phytochemicals, meaning supplementations from plants, vegetables, some of the nutrients, and this is be the main focus of our lecture today, is are there a whole lot of data or research that actually supports some of these vitamins and minerals that can recover for nerve injuries. So let's talk about lipoic acid. There's two different types of lipoic acid, alpha and gamma lipoic acid. All your B complexes, B1, B2, B3, B5, B6, B7, B9, B12, all these can be critical in nerve regeneration. I highlighted the three really important ones, but we'll be going over each of these individually. Then ubiquinone or CoQ10, and antioxidants such as melatonin, vitamin C, N-acetylcysteine, or also known as NAC, acetyl L-carnitine. So we're going to take a deep dive in a lot of these supplementations from a research standpoint, and if there's how much evidence is there to really treat peripheral nerve injuries to accelerate and assist the recovery. So first on the list is lipoic acid. So if we look at some animal studies researching lipoic acid's effect on sciatic nerve injuries in an animal model, they found that these results suggested that ALA is a neuroprotective agent for peripheral nerve injuries, as well as promotes peripheral nerve regeneration via an anti-inflammatory, anti-apoptotic effect, meaning they stop the cells from dying. And additional animal models also show that ALA treatment produced significant improvements of sciatic function index values with non-significant improvements on electromyography compared to B12 treatments, meaning function improved greatly with ALA, but as compared to vitamin B12, ALA and B12 did about the same improvement from electrophysiological function. Then when they actually looked at the histopathology, meaning they looked under a microscope to see the structural components of the nerve, ALA was more relevant in axonal structure recovery comparison to B12. So improved the swelling around the nerve as well as the outer coating around the nerve called the myelin. Then in animal models, there's a couple studies looking at carpal tunnel syndrome. There's this one, and then another one looking at carpal tunnel syndrome. And both of these studies showed that both types of lipoic acid, both ALA and GLA, induced antioxidant protective actions, reduced inflammation, promoted neuroregeneration, and decreases patients' pains, as well as when we looked at the function of the nerve, the electromyography showed significant improvement of ALA and GLA, but which was compared to just an overall multivitamin, didn't show too much improvement. So LAA and GLA seem to be very significant for assisting in nerve regeneration as well as very neuroprotectant. So let's talk about B vitamins. So there's a host of B vitamins out there, and they act as coenzymes in substantial fractions of enzymatic process and play a key role in interactions for a majority of cellular functions. Thus, these are important for almost every different type of function in your body, including the nervous system. So if we look at some of these complex pathways, B12 are very critical for the entire pathway. Now you don't need to really know what this pathway is, but this is just how your body generates energy to help the repair. And B vitamins help along the way in multiple different pathways. We can see B vitamins are coenzymes, meaning they assist the function of your body's cellular processes. So all these vitamins are very critical in the entire process in accelerating regeneration. Now ubiquinone or CoQ10. This is an antioxidant with bioenergetic and anti-inflammatory properties and protects the cells against apoptosis of neurons, meaning apoptosis is cellular death. So it helps protect the cells from dying. Essential cofactors in oxidative phosphorylation and mitochondria. So mitochondria is the units of your cellular membranes that actually produce energy. So they help function the cellular membranes as well as mitochondrial function to increase your oxidative protective functions. And here's a research study working on type 2 diabetes with peripheral neuropathy. And CoQ10 showed superior bioavailability in the form of ubiquinol. So if you're looking for a supplementation, you really want the ubiquinol comparison to the ubiquinone, because these will have a greater viability, meaning they can help your peripheral neuropathy as well as your body will absorb it and use it. So other antioxidants such as vitamin C, which is an essential for development and physiological function of the nervous system. So as we develop, vitamin C is very critical for the fully function neurologic system as we age from a young age. Melatonin has been shown to be very neuroprotective effects on injured neurons, anti-inflammatory effects at the injury site, scar reducing effects on reducing some of the scar tissue forming from an injury, as well as helps proliferate stem cells and stimulates axonal regeneration. If we look at N-acetylcysteine, NAC, it's been shown to be very neuroprotective, as well as helps synthesize glutathione, which is a antioxidant, a free radical scavenger, meaning bad chemicals that build up in the tissue are called free radicals. These compounds help synthesize the things that gobble those free radicals up, so they inhibit their action, so it protects your body's membranes as well as your mitochondrial function. Then acetyl L-carnitine. It is also shown to be cellular protectant for free radicals. So antioxidants basically help all the free radicals that can damage your body's cellular function, such as your mitochondrial function. Mitochondrial are critically important in your overall function. So next, let's talk about, well, how much of these should you be taking? So here's a quick cheat sheet on all the different vitamins you should be taking, as well as some upper limits and warnings about some of these vitamins you don't want to take too much of. And before you take any of these vitamins, always make sure you're discussing these with your physician to make sure there's no interaction with any current medications you're taking. So I hope you enjoyed this lecture. My name is Dr. Markle again. I'm an interventional orthopedics specializing in ortho-regenerative medicine expert. And if you have any questions, concerns, feel free to reach out to us on any of our social media outputs, as well as our website directly. And we're always happy to further discuss if some of these supplementations are going to be a first-line treatment. If you continue to have problems and pain with any peripheral nerve injuries, we have multiple treatment options and non-surgical options that can help focus on regenerating the nerves as well as improving your pain and function. Thank you. Have a good day.